on the population surge we're about to experience. We've talked about the housing crisis, roads, inflationary pressures. Hospitals, why aren't we talking more about the pressure on the health system? Because you speak to anybody in that sector, they say the waiting lists are terrible, the system's already in some sort of a crisis, and that massive number of people coming in is surely going to put pressure on the hospital system that perhaps it can't cope with.
It's a very good point, Rita, and one that I've raised previously, but yeah, you're absolutely right. Should have mentioned earlier, because especially if you go to northwest Melbourne or western Melbourne or into western Sydney, that's where we're really seeing that the demand on, especially on emergency departments, play out, and this will put increased pressure on our health system. And as we know, probably more than any other system it is the one that is suffering at the moment. I think here in Victoria, the biggest issue we're almost facing is what we do with our health system. And I think it's like that across the country. So it's a very good point. This is just going to exacerbate the demands and pressures being put on our health system.
Dan Tehan, I think you put your finger on it when you said the problem is with the voices that you're being asked to trust Labor. Anyone who's ever trusted Labor knows that that's the wrong way to be going. Absolutely. Dan Tehan, thanks so much for coming on Outsiders, and have a terrific Mother's Day wherever you will be today. Thanks so much, Dan.